Okay, we are going to go ahead and get started. I want to thank everybody for joining us today for this this virtual Thursday entitled "Social Networks and Health: The Power of Friends in Wellness." I'm going to introduce James Fowler here in a second, but I did want to go through a little bit of housekeeping just to make sure everything goes very smoothly for James. I went ahead and actually muted everybody. We had some crackly lines and a bit of a background noise. But if you do have questions, we'll be able to get those answered for you. Again, muted everybody. So I apologize for that, but we'll be able to interact through the chat box. If you do have questions, we do ask that you hold them to the end, especially now that you're muted. It may be a bit extra difficult to ask them. If you have something burning and you're going to forget it or something and you don't have a Post-it note to write it down on, feel free to chat it, and if James doesn't see it, we'll see if we can get it addressed promptly. You can also raise your hand. There's a little raise hand button there if you want to be unmuted and ask your question that way. Again, there will be Q&A at the end. If you want to be unmuted to ask your question, feel free. We can unmute you, or if you're too shy, you can again just chat it in the chat box there. We will be recording this presentation and putting it on the ILN archives, so you can access it later, and we'll make sure that that's done later today. So let me introduce our presenter. So James is a professor of political science and medical genetics at the University of California, San Diego. His work lies at the intersection of natural and social science with a focus on social networks, behavioral economics, evolutionary game theory, political participation, cooperation, and general politics. His research has been featured in numerous best of lists, including New York Times Magazine's Year in Ideas, Times Year in Medicine, Discover Magazine's Year in Science, and Harvard Business Review's Breakthrough Business Ideas. Together with Nicholas Christakis, James wrote a book on social networks for a general audience called Connected. And just as a personal note, I read Connected, being involved in social networks. Thought it would be a good fit, and it was. And then through this kind of weird, kind of a network thing, I was invited to a Innovation and Advanced Technology Group event at the Kaiser Permeante's Garfield Center, where a company that James works with was presenting.
Hey, welcome.
And we got somebody talking there. Hold on one second here.
Yeah.
All right, we muted everybody again. Anyway, so again, thrilled to have James here, and I will stop talking and let James do the talking here. I'm just going to go ahead and unmute you so you can give you control. Thanks, James. Appreciate it.
Thank you so much, and thanks for this invitation to talk with you guys. I'm hopeful that after I spend some time talking about our research that we'll be able to have more of a conversation about some of these ideas. So first of all, I just wanted to say that when I tell people that I study social networks, everybody's mind these days, it goes right to Facebook. And in fact, I and my partner in crime, Nicholas Christakis, we actually started doing this kind of research over 10 years ago. And we were interested then not in online social networks, but in social networks like these. These are real social networks. These are our real friends, our close face-to-face contacts, the kind of social activity that we have not only in modernized life, but the kind of activity that we've had since we were huddled around campfires on the Serengeti. And so we have been really interested in trying to figure out what impact these friends have on us. And by figuring that out, we hope to be able to learn how we can use the power of these friendship networks in order to make our lives better, especially with respect to health. Now, before I get too much further into some of the technical details of social network analysis, I just want to remind everybody that everybody lives in a social network. And it's really important, I think, before we talk about this in an abstract sense, for you to think about your own networks. And so I want you to think about who are your friends. And I want you to make a mental list. Close your eyes and think about this. And the way we usually elicit this list whenever we're trying to generate these social networks is we ask one of two questions. We ask, who do you discuss important matters with? So for yourself, think about this question. Who do you discuss important matters with? And you can make that list. And then we also ask, who do you spend your free time with? And you'll notice that those are two sort of different questions, because sometimes you spend leisure time with people that you don't really discuss important things with, and vice versa. Usually we find that when people answer these two questions that we get pretty close to the kinds of people that they would think of as friends, even though people tend to have very widely varying definitions of friends. And when we ask these two questions in a national survey with Gallup, we found that people would name somewhere between 0 and 8 of these people. And so each of you is going to have a different number of people on your list. And so keep that social network of your own in mind as we're thinking about some of the maps I'm going to be showing throughout the presentation. Each one of those friends that you have a connection to is a social network. We can sort of just draw a boundary around you and your friend, and there's you, your friend, and the relationship between the two of you. Now, one of the things that I think is really important to realize is that it's not just you and that one friend, that many of you probably named several people on your list, and so we actually have many pairs. And this is where things start to get a little bit complicated. But you'll notice that some of these pairs are actually interconnected. And so just for example, on the call right now, we had people saying hi to one another who probably already knew one another. These aren't just pairs of people. Sometimes they're triangles. Sometimes they're even more complex structures. And when we zoom out, one of the things that you realize is that this interconnectivity is one of the things that makes social networks so rich. The fact that we have things that we do that have an impact not just on the people that we can see, but potentially also on all these other people in the network that we can't see, makes each of us very powerful, and it also makes us subject to influences that we ourselves sometimes can't see. Now, when you're thinking about your own social network, it may not be obvious to you where you fit in one of these maps. You may know some basic features of your network. So, for example, you can count up the number of people on your list, and that's going to tell you, how connected you are. Some people are going to have 1 or 2 people that are on their list. Some people have several. In this diagram that I'm showing here, person D has 6 friends, but person B has only 4. And so in that sense, we would say that person D is more connected than person B. But other than that, we aren't really sure where those 2 people sit in the larger social network. And this becomes really important because you can have people who have similar numbers of friends, like person C and person D in this image. They both have 6 friends, but they have a very different position in the network because their friends have different numbers of friends. And so person C has friends who are well connected to the network, and person D has friends who aren't well connected to the network. And so in this sense, person C is more central. And the reason why centrality is important is because the people at the center of the network are going to be people who are a shorter number of steps from everybody else. So if a deadly pathogen is spreading through the network and it randomly affects somebody, the people in the center are going to tend to be affected sooner than the people on the periphery. If the Black Death is rolling through Europe, you don't want to be the life of the party, you want to be a hermit. And so there are advantages to being at the center because you get the social support and you have these large number of friends and friends of friends, but there can also be disadvantages that we've been exposed to over the course of evolutionary human history. There's also this measure that we call transitivity. It's this idea of how dense is your social network. It's literally the probability that 2 of your friends are friends with one another. And so do each of the friends on your list, are they friends with one another? But it becomes really interesting because a lot of these individuals, you'll know some of the people that they're friends with, but some other people you might think, well, I'm not sure if Shanti knows Susie. And it's this lack of familiarity with even something as close as whether or not 2 of the people that you know, whether or not they're connected to one another, that really highlights the importance of doing these kinds of maps, because these are things that we can't see from our own perspective with our own lists. These are things that the analyst has to see, or that someone's collecting data has to see in order to be able to make inferences about how these networks are structured and what kinds of effects can spread through them. Now, I started my work with Nicholas Christakis looking at these large-scale social networks by looking at the Framingham Heart Study. In this study, this is a wonderful study. It's been going on since the 1940s. They have people come in every couple of years to see a doctor to get a lot of third-person measurements of their health. And they also fill out surveys about their health and also about different social features of their life. And they're still following some members of this original cohort that started in 1948 in the small town of Framingham outside of Boston. And they also started following the children in 1971 and the grandchildren in 2002. Well, one of the things that we discovered whenever we started working with the Premium Heart Study is that they had been keeping really detailed administrative records on people's social connections. And these social connections included where people lived, so we know who the neighbors are. They included people's extensive family lists, so we know who's related to one another, where people worked, so we know who the coworkers are. And they also asked people to name a close friend. And so since 1971, they've really been collecting social network information, not for the purpose of research, but for the purpose of being able to contact people to keep them coming back year after year so that they keep the response rates up in their study. And so we were really, really excited when we found out that they were keeping this information. We made it electronic. We turned it into social network information. And we started thinking about, well, how do we present this in a new way? The traditional way of showing social network effects is to show where people live. And so, for example, here's a map of Massachusetts, and the dark blue square is Framingham, Massachusetts. And you can see that the members of the offspring cohort, that they don't all just live in Framingham, that some of them have moved away. They've spread out across Massachusetts to the Cape and so on. In fact, they've actually spread out across the whole United States. And so here in California, we have more than 100 participants in the Framingham Heart Study. And the way that we would use this geographic information typically in the past to think about social network effects is we would draw a map like this, where what we would do is we would place a person where they live, and we would figure out some average value for their neighborhood, for their census tract, for their city, for whatever the geographic location is. And so, for example, this map compares median income to where people live, and you might find out, what is the relationship between that and, say, some health outcome like your body mass index. The problem with this is that while it's true that some of your friends live nearby, many of your friends actually don't. So I want each of you to think about your list. Think about the people on your list and where they live. Do they live next door? Do they live in the same city? Do they even live in the same state? We are so mobile in modern society that many of these relationships, they actually span hundreds of miles. And new technology allows us to keep in touch with people that we still consider close friends. And this is one of the very first things that we found when we mapped the relationships in the Premium Heart Study, is that while it was true that you're more likely to have close relationships with people who are close, about a sixth of the relationships that people claimed as close friendships actually existed between people who lived at least 300 miles apart from one another. And so we needed a new way to draw these maps in order to consider what impact each of these individuals had on one another. And that's why we started drawing maps that look like this. This is a map where what we do is rather than placing people in geographic space, we place people in social space. And the way that we do this is we take each of the individuals as a circle in this relationship, each line as a relationship. And what we try to do is we try to place the circles in this diagram in such a way that we minimize the amount of distance there is between them and the people that they're directly connected to. And we get these maps of networks that everyone I think now is very familiar with because of this revolution in online social networks, where you're able to see whether or not you're central or peripheral to the network. You're able to see the people who are connected to you. And so once we had this new way of conceptualizing social effects, what we could do is we could actually, in these maps, start to put information to help us think about what kinds of effects we might find. And in this particular map, what we did is we colored the people who had a body mass index greater than 30. In other words, the standard definition for obesity. We colored them yellow. We colored the other nodes red. And in fact, it's a little hard to detect here, but we also made the size of each node, each circle, proportional to body mass index. So larger people are literally larger circles in this image. And one of the very first things that you can see in this image is that there's clustering, that people who are obese tend to be connected to other people who are obese. People who are normal weight tend to be connected to other people who are normal weight. And in fact, one of the very first things that we had to do is we had to think about, well, are we just seeing this because we want to see it, because we think social networks are powerful, or is there some way to statistically validate these associations? And so what we did is we started to think about, well, what would the relevant comparison be? Well, the relevant comparison would be what happens if we randomly just reassign who's obese and who's not, And we do that a whole bunch of times so that we're able to get this distribution of what would happen due to chance. Because you might be connected to someone who's obese and you're obese, and it might just be by chance that the two of you are connected. There might not be any kind of causal relationship. Well, when we did that, we were able to sort of figure out, these ranges of possible values. As it turns out, the amount of clustering that we found in these networks was actually much, much higher than what you could explain due to chance. And so just to give you an example, across all 7 waves of the study, one of the things that we found was that if you're directly connected to someone who is obese, it increases the likelihood that you're obese by about 40%. If you're connected to a friend's friend who's obese, that's 2 degrees of separation, it increases the likelihood that you're obese by about 20%. And if your friend's friend's friend is obese, it increases the likelihood that you're obese by about 10%. And beyond 3 degrees, the numbers went to 0, and this null distribution of these random effects actually swamped the observed effects. And so we find these clusters out to 3 degrees of separation and no further. So you might think that, aha, this is evidence for influence, but not so fast. One of the problems is that there are other reasons why you might have socially connected people exhibit the same kinds of outcomes. One, of course, is influence. One is this idea that when one domino falls, then the next domino will fall, and the next domino will fall. If I affect you and you affect your friends, then things that I do will also affect my friends' friends. But another possibility is that you and I became friends with one another in the first place because of the trait that we're interested in. And so just for example, people who like going to the gym might become friends with other people who like going to the gym. And as a consequence, people who are normal weight will tend to be connected to one another because of this process called homophily. This is one of my favorite words. It's a word that literally means love of like. It's this idea that birds of a feather flock together. If you look at the screen there, those birds didn't make each other look that way. They joined one another because they realized they were a similar type. And so this is one of the key problems in observational studies, is trying to figure out how much of this clustering is due to this friendship selection mechanism. Another problem that we have, though, that doesn't get mentioned as much is the problem of context. So some people might be exposed to the same kinds of things as other people. A gym might open up down the street from you and your friend, and independently, each of you join and you start working out and you start losing weight, even though you might not know that the other person has joined the gym as well. So this isn't influence. You didn't influence your friend to lose weight. This isn't context. You didn't become friends with this person because they joined the gym. This isn't homophily. This is context. This is the idea that you have this local environmental variation that can drive people who tend to be socially connected to also be similar in these attributes. So this is a tough problem to work all this stuff out. Fortunately, one of the things that we were able to do is we were able to make these movies over time, showing how not just the effect spread, not just how, for example, obesity spread, but also how the network changed. And the reason why this is important is because in our statistical models, one of the things that we can do is we can try to model the friendship formation process prior to looking at any association between one person and another person's health outcomes. I have a beautiful movie. I think it won't show up in this context, but it shows you how the network changes over time. It really gives you the sense that we're part of this larger superorganism. But this data is really valuable because it gives us a little bit more information than we would otherwise have that suggests that really a good chunk of what we're seeing in terms of this clustering effect is actually due to influence rather than to homophily or one of these other factors. And whenever we did that modeling, one of the things that we found was that different kinds of relationships can yield different kinds of effects. So if you name someone as a friend and they become obese, then 2 years later, it increases the likelihood that you will become obese by about 57%. If you name a person as a friend and they name you back, which is a sign of a stronger relationship, it actually triples your risk of obesity if they become obese. Meanwhile, if a person names you as a friend, but you don't name them back, their outcome has no statistical impact on your own outcome. And this is because, some of the people on your list, unfortunately, I'm sorry to say this, but some of the people on your list, you might not be on their list. And while that's sad for you, it's actually valuable for researchers because we can use that asymmetry, just like we can use time to see what effects come before one another. We can use this social asymmetry to see the direction, these directional effects that happen in these social networks in order to try to figure out how much of what's going on might be attributable to influence. Another really important thing that we did is we checked to see what the relationship was between people who are immediate next-door neighbors. And we found that the effect of your neighbor becoming obese was actually 0 on your own likelihood of becoming obese. And this suggests that these clusters aren't being driven by context. There's not something going on in your neighborhood, a new gym opening up that's driving the effect. Instead, it's likely to be some combination of influence and homophily. So we followed up this original study with a number of other studies. We looked at smoking cessation in the same population, and this is the exact opposite of the obesity epidemic. What we saw was that rather than increasing from about 10% to 40% incidence, we decreased from 40% to about 10% incidence. And one of the really fascinating things that we found here, in addition to finding that smoking behavior spreads to 3 degrees of separation, is that we saw changes in the network that were a consequence of the behavior. So starting in the early 1970s, you could smoke and you could be at the center of the network or you could be at the periphery. But by 2001, if you smoked, you had been pushed to the outside of your social circles. Starting in the mid-1980s, people who smoked gradually had a decrease in the quantitative measure of centrality. And this is really important because what this means is that while we were making a lot of people healthier with these public health campaigns driven at using peer pressure to get people to stop smoking, we were making the quitters healthier. The people who couldn't quit were actually being made less healthy because we were disconnecting them from their social networks from which they could derive social support and through which we could access them in order to get these positive health messages. And this is one of the things I worry about with efforts at possibly using social pressure campaigns to reverse the obesity epidemic. We need to make sure that we're not socially ostracizing people when we use these kinds of tools. We also looked at drinking behavior, and drinking behavior is kind of interesting because our best guess right now is that optimal drinking behavior is in the middle. It's a Goldilocks phenomenon. And so moderate drinking is a little bit better for you than abstinence, and heavy drinking is kind of bad for you. And we found that there were these clusters, again, in abstinence behavior, in normal drinking behavior, and in heavy drinking behavior out to 3 degrees of separation. But a fascinating thing that we found here was that while it looks like one person can influence another person to drink heavily, it matters a lot what gender that person is. Although men are more susceptible to heavy drinking, it was women who accounted for the lion's share of influence as messages spread from person to person to person about what appropriate behavior was. And so this gives you a dilemma that you wouldn't know about if you hadn't done social network studies. Do you treat the people who are susceptible, or do you treat the people who are influential? It's not at all obvious which of those kinds of interventions would be more effective on a per subject or per dollar basis. And this is another reason why it's really important to start to integrate some of the social network information that we have in order to be able to evaluate interventions. A lot of the times, if you just study the person whose behavior you're trying to change, you're going to be missing the lion's share of the effect of the intervention because you're not going to know what these spillover effects are to other people. Now, we wanted to think a little bit more about why these behaviors had such strong clustering out to 3 degrees of separation. And one of the things we started to do is look at the psychological literature on the spread of emotions. And it's self-evident to most people that these emotions can spread. You know, when you walk down the street and you see someone smile at you, you can't help but smile back. Now, we told this to a reporter from the New York Times, and he said, "Oh, we don't do that in New York." But for most people, this is a phenomenon that we're familiar with. This is a phenomenon that we've experienced where we tend to take on the moods of other people around us, and they've shown this in the laboratory time and again. In fact, we even pick up the moods of representations of humans. And so there's a robot Einstein that they've created now where people just unconsciously tend to mimic the emotional state that's on robot Einstein's face. And so we wanted to go back to the Permeante heart study and see whether or not these clusters of behavior might have something to do with the clusters of emotions. And so we looked at happiness. People at a few waves in the study had reported on how happy they had been in the previous week using a standard scale of questions. And here what we did is we created a new one of these maps where what we did is we colored the people who were happy yellow, and we colored the people who were sad blue. Get it? Blue? Yeah, so I know it's a bad joke, but what we found was that these colors indicated, again, these clusters that extended out to 3 degrees of separation. If your friend's friend is happy, then I can do better than chance of predicting whether or not you'll be happy. And the results suggested that at least part of this was due not just to homophily, but also due to influence. Now, there's been a debate about how much you can actually learn from observational studies because of this problem of homophily. And so we've started to do experimental studies where we randomly assign people to be exposed to each other. And when you do this process of random assignment, you get rid of the problem of homophily because there's no longer going to be correlation in people's outcomes because birds of a feather flock together. And so one of the things that we've done is we've tried to think about, well, what can you study in the laboratory setting? You can't study obesity, right, because you can't bring someone in for an hour and then put them on the scale at the end of the study. But you can study other things. And one of the things that's been of interest to economists recently is these behavioral economics games, where we're trying to learn about changes in generosity, for example. And these public goods games that people play, they make a choice between keeping money for themselves or donating it to the group. And one of the things that we found is that in some of these classic studies by Ernst Fair and others, they had unintentionally, in order to keep people from playing with the same person twice, created a network that they hadn't really analyzed as a network per se. So 4 people would play a game together. They would see the outcomes of that game, and then they would go off and play with new people. And the way they played with the new people was affected by what they saw previously in the game that they played with the first group of people. And one of the things that we found was that if you are exposed to people who are more generous in the first round, then when you play with a new group of people in the second round, that you are more generous. And that this actually spreads. So that if Elaney gives more when he plays with Lucas, then Lucas will give more when he plays with Erica. And in turn, Erica will give more when she plays with Jay. And in turn, Jay will give more when he plays with Brecken. So these effects experimentally extend out to 3 degrees of separation. And the amazing thing about this is that each dollar of giving in the first round yielded an additional $3 in giving from these spillover effects. In other words, the network acts like a matching grant. And we are really interested in trying to figure out how to utilize this matching grant property of networks in order to be able to spread positive health behaviors and positive health outcomes and to structure networks in a way to get the most we can out of our health systems. So we have all these different studies now that are showing this 3 degrees effect, that these results don't just affect behaviors, don't just affect emotions, they affect a wide variety of things out to 3 degrees of separation. That friend contains a lot of information about what's going to happen to you. And one of the questions that we've been asking recently is, well, why is this the case? Well, one of the possibilities is that we actually evolved in small groups of individuals where we were not connected to other people at a distance beyond 3 degrees of separation. So what we've done is we've actually mapped the networks in a group of hunter-gatherers called the Hadza, and we had them choose their networks. You can see on the picture there that they looked at pictures of other people that had been in the same group and identified the people with whom they would like to camp. We also asked them to give honey sticks to people, and they could choose whoever they wanted to give honey sticks to. And so we had different ways of measuring these networks. And the fascinating thing here is that the networks of these hunter-gatherers who lived the way we did hundreds of thousands of years ago look almost identical to modernized networks in every way that modern social network analysts measure these networks. And so to us, what this means is that there's something deep here. There's something deep in human identity and human behavior that transcends modern society, that it goes way back in time to our earliest roots. And in fact, it goes so far back that what we're finding is that there's even evidence that genes have an impact on the structure of these networks. And so just for example, when we compare identical twins to fraternal twins, we find that identical twins have networks that are more similar to one another on a number of properties. So the number of people who name you as a friend is about half heritable. How central you are in the network is about a third heritable. And even transitivity, the probability that 2 of your friends is friends with one another, that also is heritable to the tune of about 50%. Now think about this for just a minute. What this means is that your genes have an impact on whether 2 other people are friends. And we find this to be just extraordinary. In some sense, what this means is that we shouldn't be using this Robinson Crusoe method of studying the effect of genes on our behavior and our health outcomes. We are metagenomic. Our genes are impacting our phenotypes, which then spread through these social processes, meaning that our genes are indirectly affecting our friends' friends, and so on. And in fact, we've even identified specific genes that we tend to share in common with friends above and beyond what you would expect due to becoming friends with people of the same ancestry. And so homophily is so strong it extends even to the genotypic level. So these natural social networks, they're an intense and ancient part of what it means to be human. And so this brings up a question, which is how do we take these natural social networks online? People always start with this. You must be an expert on Facebook when I say I study social networks. That's not where we started, but that's certainly where we are today because of the vast amount of information that we have online and the question of whether or not these online social networks are telling us something about real-world social networks. And so one of the things that we always use, we talk about a little experiment that we did with Alyssa Milano. As it turns out, she's a television actress, in case you don't know who she is, but she is a tweeter. She actually tweeted a link to our book, and we thought that this was very exciting because she has over 1 million followers on Twitter. But consider the fact that online, you have a different kind of relationship with 1 million people than each of you has with the people on your list, the people that you spend for your free time with, the people that you discuss important matters with. I doubt that Alyssa Milano would put all 1 million of those people on her list. And so the question is this kind of online influence effective? And so this toy example, what we did is we looked to see, well, once she tweeted, well, what happened to our book sales? Well, this is a map of our book sales over time, and that red circle is where she tweeted. You can see that just anecdotally, it doesn't look like this one tweet actually helped at all. And this is one of the problems, is that there's an immense amount of information online flowing between people who are only weakly tied to one another. And so we think that the key online, this is just an anecdote, but we think that the key online is that you really need to find the real friends on Facebook. You need to find the strong ties, because it's these strong ties that tend to matter. Remember, obesity appears to spread between friends, between spouses, between siblings, but it didn't spread between next-door neighbors. And so this is going to be a really critical feature, I think, of the efforts going forward the next 5 to 10 years, is how do you figure out which of these people online has a real-world relationship? And just to give you an idea of the difference in scale, this is a map that we did of a college dorm where we looked at the real-world relationships. We asked people's name friends, just like I asked you to name friends on each of your lists. And we compared that to other kinds of real-world relationships. So you can be in the same club, for example, or you can be roommates with somebody. And now compare that to Facebook. It becomes a big ball of spaghetti. The average person today has over 150 friends on Facebook, compared to the 0 to 8 people that were named in this Gallup survey of close real-world social contacts using the questions I had you answer before. And so we have to figure out who are those 5 to 10 people amidst all those 150 people that are your friends. So one of the ways that we do this is by actually restricting the Facebook network to just those relationships that are close. One way to do this is by looking at who tags photos of one another. And when we do that, we get a network that looks a lot more like this, and we see clusters of behavior that's similar to the behavior we saw in Framingham. So for example, people who are smiling in their profile picture are colored yellow, and people who are not smiling are colored blue. That's my collaborator, Nicholas. I always have to make fun of him here. And here what we find is that in the photo friend network, these closer friends on Facebook, that we find a correlation. In the whole network, when we look at all 150 friends, we don't find a correlation. This is also true of obesity. We find clusters of overweight women and clusterways of overweight men on Facebook as evaluated by their Facebook photos that extend out to 2 degrees of separation in the photo friend network, but we don't find any correlation in the Facebook friend network. So we have to figure out, what kinds of signal do we have online to be able to find these real-world friendships. So I just want to conclude before I have a chance to do some discussion by talking about the next phase in our research, which is trying to figure out how to use all this information to now intervene in social networks. And I'll talk to you about a couple of things. First of all, you can either act on connection. You can change the structure of the network, or you can act on contagion. You can act on what flows through the network. Now, acting on connection is going to be very, very hard. So I want each of you to think about your own list. How much money would it take for you to stop being friends with one of those people? How much money would it take? What would I have to do to get you to add another person to your close friend list? This is not an easy task, and there are subtle things that we can do to drive this process, like roommate assignment in colleges or bunkmate assignment in when you join the Army. But other than that, there are very limited opportunities to structure these networks. This is why we've been so focused on contagion. And so one of the things I want to talk to you about is some efforts that we've made to predict the future using what we know about the spread of these contagions. Also a means to identify high-cost hospital networks, and also a means to identify highly influential doctors in networks. So first of all, with the flu epidemic, Once again, I'm sad that we can't show a movie here, but this is a set of friends, a friendship network at Harvard University in the fall of 2009. And one of the things that we did is we followed this network. We watched to see who got flu-like illnesses, which that season was probably H1N1 flu, and who didn't. And one of the things that we found in this study is that people at the center of the network, they tended to get the flu sooner than other people in the network. And if you think about it, that makes sense because there are a shorter number of steps from everybody else in the network. Also, people at the center of this observed network are also probably more likely to be at the center of the unobserved network, all the interactions that people have that went unreported in this. And so the flu might spread via face-to-face networks that aren't even represented here, because in this case, we just asked people to name 3 of their closest friends. And so one of the things that we wanted to do is we wanted to think about, well, what if you didn't have access to all this network data? Is there some way that you could use these network principles to be able to predict the future in the same way as you could if you monitored the people who are most central in a known network? And so think about a network like this. One of the things that you can do if you don't have network information is you can just look at the behavior of a randomly chosen set of people. So the people that you randomly monitor, these yellow dots, some of them are going to be peripheral and some of them are going to be central. You're not going to really get any advantage out of the network itself in terms of being able to detect the flu at an early stage. But one of the things that you can do is you can ask each one of these people to name a friend. And the reason why this will tend to get you people who tend to be more central is because of this well-known phenomenon in social science called the friendship paradox. And it goes like this: your friends have more friends than you do. And I know that will make some of you very sad, but it's true. And the reason why is because of this mathematical property. Your friends who have 10 friends are 10 times as likely to be named as a friend than your friends who have 1 friend. And so they're going to be on 10 times as many lists. And so the average number of friends of the people on your list for about 85% of you is going to be higher than the total number of people on your list. And so what you can do is you can utilize the fact that these random individuals, they can give you one piece of information, which is to name a friend, and then you go and you monitor the behavior of the named person. Those people are going to be more central on average, and they're going to give you an advanced warning of anything that's spreading through the network. And so what we expect is this theoretical academic curve to be shifted forward in time for the central individuals, these named friends, compared to the population, which is represented by these randomly chosen individuals. And that's exactly what we find. This is the empirical data. And what it shows is that the friend group actually got the flu about 2 weeks in advance of the randomly chosen group. And so if you had some threshold that you're waiting to cross to know that you had some kind of epidemic underway, you would have known that about 2 weeks earlier in the friend group than you would have if you'd been monitoring the population as a whole. And again, this doesn't require any network information. All this requires is monitoring the friends of a randomly chosen group. And so we're hopeful that this will be useful in a wide variety of contexts, because it's not just pathogens that spread through networks, which I hope I've demonstrated to you from some of our other research. It's information, it's emotions, it's norms, it's behaviors, all of these which can have relevance for health outcomes. You talk about attitudes towards vaccination. You talk about vaccination itself. You talk about screening adherence. There are a lot of these different kinds of things that can spread in networks, and we're hopeful to be able to monitor these things earlier, because if you can predict the future, you can control the future. And we think that by not just monitoring these individuals, but possibly spending more effort acting on these individuals, you're going to be able to get a bigger bang for your buck. So another thing we've done is we've looked at physician networks. And so, for example, this is a map of physician networks in the Boston area. Each one of these colors indicates physicians that are associated with these different medical institutions. And the lines here, rather than friendships, these are shared patients. Now, this is a weaker tie than we would expect there to be for the people, for example, that are on your lists, but it is a means of sharing information. You see the same charts as the other doctor if you're sharing patients, and you see many of the same charts in common if you're sharing many patients. And one of the things that we started to do is we started to look not just regionally at the way hospitals are embedded with one another, so you can see which of them is really at the center of the local hospital network, but also looking within these hospitals and characterizing people according to specialty. So, for example, here's a hospital in upstate New York where we've colored the nodes according to whether or not they're primary care, medical specialty, surgical specialty, or other. And one of the things that you'll notice in this particular case is that the specialists tend to be at the center of this network. Well, we compared this actually to another network where the generalists were at the center of the network, and one of the things that we found was that end-of-life care costs and also the number of days in the hospital was much higher in the hospital where specialists were at the center of the network. Now, this is an association. It could be other things that drive this relationship. For example, it could be that some hospitals have a reputation for being a specialty hospital, and so it draws in both specialists and also people who need more intensive care. But we did do a study on hundreds of hospitals across the country and found a robust relationship that the more often you found generalists at the center of the network, the lower costs were in the last 2 years of care. And so one possibility is that there are ways that we could structure the work environment to encourage relationships between generalists and connect them better to the network in order to bring down costs overall in some of these hospitals. It's an idea that hasn't been tested, but it's implied by this observational study. And then the last thing that we've really been trying to do, and this has been very active work with Activate Networks, is trying to use this information to target interventions. And so what we really want to do is we want to use this network structure to identify influencers. We also want to use this to identify people who are influencees. I think not enough attention is paid to the fact that it's not just being connected to a million people like Alyssa Milano. It's how much are those people going to be receptive to the kinds of messages they're receiving. And we want to be able to use this network information and past, for example, prescriptions behaviors in order to be able to identify which of these doctors is going to give us the biggest bang for our buck whenever we're trying to give them some new information or trying to change their behavior to increase quality of care in some way, for example. And so one of the things that we really want to do, first of all, is map these networks, and we can identify different communities of practice, for example, that we might not have been aware of through these informal relationships. And so we have these structural ACOs that we often think about that are functional in nature, but it could be that you have an informal set of relationships that's much stronger than those formal organizations that really go into the kind of care that a patient gets. And you can automatically detect these communities using network analysis, like community A and community B in this diagram. You can also detect clusters of doctors that are high-performing physicians or non-high-performing physicians and really target those for changing behavior on the one hand or for spreading behavior on the other hand. Because once you get all that reinforcement in a densely connected group, there's evidence from work by Damon Santola, for example, that complex contagion is going to make this spread even faster. You also want to really think about not just network position, but also receptivity to change. And one of the things that we're realizing is it's a combination of past behavior that shows that you're willing, for example, to prescribe new medications or to try some new practice that's going to improve your quality. It's receptivity plus your network position that really makes you most effective in terms of spreading these innovations throughout a doctor network. And increasingly, we're finding that we're getting a much bigger bang for our buck by doing that kind of targeting than targeting it was typically only looking at people's past behavior without the network information. We're also using email data, for example, to try to infer some of these networks. If you think about the people on your list, you probably send a lot of emails to some of those people, and so this is one good way at measuring network information when you don't have it and doing it in a passive way that's not going to be intrusive. And increasingly what we're doing is we're using this to try to identify employee communities. And one of the things that we find is community detection is that these communities tend to have similar health behaviors, and they may be good targets for campaigns to increase exercise or to change other kinds of health behaviors in the workplace that would help to improve wellness. And just as an example, one of the things that we're finding right away, which is a confirmation of the work that we found in Framingham, is these clusters of obesity that tend to correspond to some communities and not to other communities within the network, these clusters that extend out to 3 degrees of separation. So let me just conclude by saying that this work, I think, has tremendous potential to revolutionize the healthcare industry. But for me, there's also been this personal message, which is realizing that we affect people that we see, like the people on our list, but also the people that we can't see, like the people on their lists. And the people on their lists I think has the potential to transform how we see ourselves and the kinds of efforts we make in improving our own lives. This young man in this movie, Pay It Forward, he is actually a budding network scholar, as you can see from his diagram on the board. And what he really wanted to do to make the world a better place is to have people do 3 random acts of kindness and ask for nothing in return other than that those individuals who received the act to spread that act to 3 other people. So that 3 becomes 9, becomes 27. And we experience the power of this exponential feature of human social networks. And for me, this has really helped in my own behavior, and it's helped me to reorient this idea that each of us should think about these things in terms of our own network power. We have this personally, we have this as organizations, we have this as analysts, and we can use this network power to really change the world. And so with that, I'd like to thank you guys and thank my personal network, and I'm really looking forward to some discussion.
James, fantastic. Thank you so much. I read your book about a year ago, and I think I put on a couple pounds, and I quickly dumped like 5 of my friends right away. I was like, you guys are cut. No, but it's just really interesting to see. I think we hear in healthcare, we hear about social determinants of health, but really I think we think of it more in terms of socioeconomic and maybe geographic footprint. But really, I mean, looking at your footprint in a social geographic space, or even looking at your genes as a determinant, it's amazing. So I think it gives us a different framework for how to think about health and our network. So thank you so much. Everyone is muted. We have a big group today, so I would say, if you have a question, let me know. I'll go ahead and unmute you so you can ask it in person and not just in the chat box. If you're too shy, that's fine. You can chat it. But I do have one question right off the bat here. I had to copy it. Let's see here. It's from Kathy Knoll. I'm going to send it to everybody here so everyone can see. And I'll let you read it. In the generosity game, did the people know each other? Did they know each other? Were they strangers initially? If they were friends already, wouldn't the phenomena you saw about being generous become stronger because they were connected as friends?
Yeah, that's a brilliant question. And one of the things that we always point out is that these experiments in the laboratory, these artificial networks, one of the downsides is that you can only measure weak ties because you're randomly assigning people to have these interactions with one another. And so it solves the problem of knowing for sure that it's not some kind of friendship selection, but now you're measuring something that's much more likely to be a weak effect because we are more influenced by people we have a stronger tie to. The solution is to do these experiments within the context of a real-world social network. And so we've been working directly with Facebook, for example, to look at how you can experimentally induce behavior and how that spreads across a real network. And one of the fundamental insights from that work is going to be that the stronger the tie, the more interactions you have with this person online, and the more likely you are to be real friends in real life, the stronger the effect is, the more likely it is that you're going to be influenced by the change in behavior that was induced by the experiment. So that's a great point, that there's only limited information that we can get out of the laboratory studies because we're not going to be able to do this between close friends there.
Very good.
So we've got a question here about Alaska. Populations were at 63% of people. Okay, so 63% of the people in Alaska are tobacco users, and the question is, what is the best way to address this behavior? So I think one of the things that our research is showing is that people tend to copy the behavior of those around us. But one of the things I didn't mention is that in the tobacco or the cigarette cessation study, one of the things that we found was that people didn't tend to quit on their own. They tended to quit in groups. They quit in droves. And so one of the things that I think that we would recommend is that when you're doing targeting campaigns, what you need to do is you need to target groups of highly interconnected people who all exhibit the behavior. And Tom Valente at UCLA, he's actually done some of these targeted interventions and shown that if you just use information about how central people are in the network, that you already are able to get a bigger bang for your buck than if you were just randomly trying to target people in the population in adolescence. Now, where you get that information from a population scale, someplace like Alaska, is an open question. One of the things that you might do is you might get people intervention to give you information about other people that are important to them and try to target the intervention not just to that focal individual but also to that person's friends with that person and their friends' consent. There are lots of other ways that you can imagine designing it, but really that's what you want to do is you want to get to these clusters of smokers and try to get all of them on the program at once. Yeah, so there is this tension. This is a question from Jack Gilbert about diversity, and there is this tension between diversity and these contagion effects that we're finding. One of the very first things I want to emphasize is that in these studies, we just want to know that if there's something on average that's going on. And unfortunately, the average usually covers more interesting things that are going on. So just for example, when we've done studies of adolescents, we have found that the network effects tend to be stronger. They extend out to 4 degrees of separation. We've also found in adolescents that they are more likely to pay attention to the behavior of their friends' parents than to their own parents, because it's during this developmental period that you actually resist being influenced by a particular kind of relationship, and that's your parents. So while you're more influenced by your peers, you're less influenced by your parents. And if we were just going to average all that out, we would miss all of that diversity. And so one of the things that I really think that's important going forward, especially as we take some of this work online, is to get these large N studies so that we can start to think about, well, how do we break these things down? We've already started to do it by gender. We started to do it by relationship. But I think that what we're going to find is not just that there are average effects, but there are different types of people who are responding differently. And this is why I think the concept of how influenceable people are, whatever it is, how influenceable they are is just as important as how influential people are. Because if you are a really influential person connected to 100 people and none of them is influenceable, then you're not the kind of person that needs to be targeted. And it's characterizing that diversity that I think is going to help us to figure out exactly what parts of the network to really focus our interventions on.
James, this is Tim Rawson again. I've got a quick question. So, something I found kind of fascinating was you mentioned alienating smokers in the cessation process, moving them to the periphery. Are like folks like the Ad Council or healthcare organizations reaching out to you to kind of think about the way that they approach obesity and smoking cessation? Is that something that you've been involved with, or because I think it's probably something that ad folks probably don't think about or recognize as a result of campaigns like this.
Yeah, no, it's not a day goes by without a new email, and I try to meet with as many people as possible. It's a new area, and people are starting to get the kind of data where they would actually be able to use some of this information. So. In particular, there are a lot of startups now that are really trying to just out of their garages create apps on mobile technologies, for example, or interfaces with Facebook to generate the kinds of systems that you would need in order to be able to maximize the benefit to an individual who wants to experience positive behavior change and try to spread it to the network as much as possible. And this comes from people who are in marketing, people who are in ads, people who are in health, people who want to encourage generosity, people who are interested in donation campaigns. There's a lot of people knocking on the door, and I think that's a great thing, because I do think that in the next 10 to 20 years we're going to figure this out, and there's going to be a revolution in our capacity to make these positive changes.
Very cool. Excellent. So there's thank you for that. There's another question from Sandra. How can the genetic factor of this be addressed, or what different approach is more practical or successful?
Yeah, so one of the things that happens a lot whenever you study behavior genetics is people react to it by saying, well, what are you saying, that we should change people's genes? No, that's not what we're saying at all. The reason why we study the genes is because we want to learn about the causal mechanisms that underlie these different behaviors. And so, for example, one of the things that we found is that there's this dopamine gene variant that we tend to share in common with our other friends. Dopamine is the system in the brain that's part of the reward system. It's the system that lights up whenever you have sex or you do cocaine or you get money. It's about rewards. And so knowing that this is something that we share in common with friends, that there are people who have normal systems that tend to be connected to each other and abnormal systems that tend to be connected to one another, helps us in a couple of ways. One, it helps us to isolate what the source of the social connections are. If it's the reward system, then it starts to elicit different kinds of things that we might do in order to spur the spread of different contagions in the network. Maybe we need to utilize a reward system. It also suggests that to the extent that we can change the brain chemistry of individuals, either through therapy, through drugs, through a number of different factors, that you might not just be changing the individual's behavior, but you might be changing the shape of the network. You might be changing the behavior of the individuals that are connected to that certain person. And it also suggests that when you're trying to change the behavior of a focal individual, that it's not Robinson Crusoe, that you might need to get their friends involved because their friends might be experiencing the same kinds of problems. It goes with this question about the smokers in Alaska. You want as much as possible to try to target these tightly clustered groups of individuals who are experiencing the same kinds of problems.
Very cool. So we are actually Beatrice asked a question, and we will get that answered for her, but we'll get it offline because we are out of time, and we want to respect everybody's day and busy schedules. So again, James, thank you so much for coming on and sharing with us today. I think it really is very surprising the power of the networks, and then everyone that joined us today. Thank you so much for joining us, and look forward to connecting in the future. Thanks, everybody.
Thanks to you, and thanks to everyone. And these are great questions, and keep it up.
Thanks, James. Take care, everybody.